Let's talk about decomposition. Warning, I'm about to show pictures of a natural process called decomposition. That means that I'm about to show some pretty graphic images, and if that's not something that you want to see, I'll give you a second to keep scrolling. Today's forensic pathology basic principle, brought to you by the National Association of Medical Examiners, is about decomposition. Decomposition is really made up of two things: autolysis and putrefaction. Autolysis is an aseptic process that's caused by intracellular enzymes causing cells to break down. This breakdown of cells caused by autolysis, because it's a chemical process, can be slowed down by cold or completely inactivated by freezing, and then of course it can be sped up with heat. But the other type of decomposition, putrefaction, that's almost certainly what you picture in your mind when you think of a decomposing body. Putrefaction is caused by bacteria and fermentation. Because putrefactive decomposition is ultimately caused by the bacteria within the gut spreading throughout the body, there are two main factors that influence the way that decomposition happens. One is the body, and the other is the environment that the body is in. Things that speed up decomposition based on the body that's decomposing would be things like obesity or sepsis at the time of death. Obesity because the layer of fat can help insulate the body, keeping it warm, or sepsis simply because there's an increased bacterial load in the body. Another good example would be something like having increased blood glucose in the situation of diabetes. The environmental factors that can speed up decomposition also relate to keeping the body warm. So bodies that are on a conductive surface, like say a cool metal surface, will lose heat rapidly, and therefore their decomposition will be slowed. So what actually happens during putrefactive decomposition? We expect to see discoloration, followed by a process called marbling, a generalized diffuse bloating of the body, and skin and hair slippage. Everything starts with that generalized green discoloration, and it usually starts in the right lower quadrant of the abdomen and then overall lower quadrants of the abdomen, eventually involving the neck, face, and shoulders, and then the entire body. This discoloration typically happens in the first 24 to 36 hours, but again, things can be sped up depending on what's going on in the body and the environment that the body is in. Then we'll begin to see what's called marbling. Now, marbling is caused by hemolysis actually within the blood vessels, and then the hemoglobin from the hemolyzed blood reacts with hydrogen sulfide, causing a black discoloration and this marbled appearance. Then, sometime around 60 to 72 hours after death, the body will develop generalized bloating, and that's due to bacterial gas formation. And this can make decedents appear much larger than what their weight actually shows. A common pitfall that people don't know about is something called purge fluid. Purge fluid is related to the decomposition of the mucosal tissues within the mouth and the upper airway, and as that fluid comes out of the mouth and the nose, it can be misinterpreted as blood and make someone think that a decomposing body has suffered some sort of trauma, when in fact they're only decomposing. As decomposition continues, the skin will lose some of its attachment to the underlying soft tissue, and you'll develop what are called vesicles, which are essentially bubbles filled with fluid, and you'll start to get skin slippage and hair slippage, which simply means that it's loose and can be slid off. There are a few situations that are a little different. One is mummification. If someone dies in a hot, dry climate, rather than undergoing this typical decomposition that we've talked about, they may undergo mummification. Mummification will result in a dry brown appearance of the skin, and the organs will deteriorate into a brown putty-like substance. And then in warm, wet environments, you may see something called adipocere. Adipocere is a firm, gray-white, wax-like material that's formed from decomposing fat in those wet environments. So with general putrefactive decomposition, we talked about a discoloration, which usually occurs by 36 hours. We talked about marbling. We talked about a generalized bloating that usually occurs by 72 hours. We talked about the pitfall that is purge fluid. And most importantly, we talked about how the rate of decomposition is most dependent on the environment that it's in and the body that's decomposing, mostly due to heat. There is one main thing that's done to try to slow the body from decomposing as much as possible, and that's embalming. Now, how well the embalming works depends on the quality of the actual embalming process, but I'm not a funeral director, I don't do embalming, so I'll leave that to them to share. I'm Dr. Eric Handberg, and this was a Forensic Pathology Basic Principle brought to you by the National Association of Medical Examiners. Please go to thename.org for more information.